Welcome back. Well, today we got another great video, and this is a great case because like many people, you come to chiropractors because you have some sort of pain syndrome, whether it be back pain, neck pain, headaches, because people just associate chiropractic with that type of thing. They don't really realize that chiropractic actually does a lot more. To tell a little bit of our history, chiropractic actually started when a guy gave an adjustment that restored a man's hearing. It wasn't for sciatica, it wasn't for neck pain, it was actually restored hearing. And that's another story. But anyway, this gentleman here, like most people, came in with a whole list of pain syndromes. So he was suffering severe back pain, he had neck pain, mid-back pain, left foot pain, his hands were going numb, I believe. And then I asked him some questions, and he also let me know that he had severe constipation. He can talk about that here in a second. But a lot of people just don't know that we handle and we help a lot of visceral conditions because everything in our body is controlled either directly or indirectly by the nervous system. And your brain has to tell every cell, tissue, and organ in your body what to do through the spinal cord, and the nerves that come out the spine. So spinal damage actually interferes with that process, and really essentially wherever that nerve goes, you can have problems or dysfunction. And that's what people call their symptoms. So whether it be constipation, hemorrhoids, what have you, as a chiropractor, I don't necessarily treat the symptom, but what I'm going to do is I'm going to look and see if I can locate the source of that interference that's causing the problem. So I'm getting to the root cause of why you have it in the first place, as opposed to treating the symptom. So medically, yeah, you could give him a drug to stimulate his bowels or decrease his pain, but that's still not fixing why he has it. Okay, so I'm going to check him. He's already done great. Actually, everything's already resolved, but I want him to kind of tell his story because it's a really good one. So, Claire, just go ahead and tell us kind of why you originally came to see me and what you experienced.
Okay. So I came in here about a couple weeks ago because I had, like he said, lower hip pain. I've had that for since I can remember, and the pain would always shoot down to down my right leg to my foot, especially when I'm sitting down for a long period of time. I kind of shook it off because it kind of would go away here and there. I would have, neck pains, and I would always think that would be because I would sleep wrong. So I came in because I was having all those problems, and it's got worse over the years, to where my shoulder would hurt, my elbows, my wrists, my hands, and it felt like my hands were getting super, super weak. To where I would grab something and it just wouldn't, I could tell that I didn't have all the force that I needed to. So I came here, Dr. Waller explained to him all my situation, my pains, and then when he asked me, that one question if I had constipation, I told him yes, and I've had constipation issues for like 10 plus years since I can remember.
It's a long time.
Yeah, and things would help, like I would take supplements for it, fibers, all this. I'm diabetic as well, so they checked me for celiac disease. I came out negative for that. I had a bunch of tests run on me just to find out that, when I asked Dr. Waller about that, the very first adjustment he did for that, halfway home, I immediately felt like I had to use the restroom. Thankfully, I made it on time.
It's quicker than X-Lax.
Really. And, all the stuff that I would take me about, it would help me about maybe a week or two to use the restroom. After that, it would go right back to being constipated for long periods of time. It would take me, if I was lucky enough, it would make me, I would use the restroom maybe once a week, if not longer than that. It would take me 2-3 weeks, the max, to use the restroom just one time. And never really had the pain because I've looked up like constipation issues and the pains that it can cause you. Never really had it. I mean, it would come and go, but I never thought that chiropractor, besides adjusting me, helping fix all the other issues, can fix constipation. So, I mean, it really, really helped out that I came to Dr. Waller.
Yeah, and what's neat about it is, constipation. In my opinion, in my experience, there's several different types that I see here, and different classifications, and the worst one is what I refer to as the paralytic. And the way we help people, and when I mean it's severe, the worst case I've ever seen was a younger child. I think he was about 10, and he could only go to the bathroom about once a month, and that was usually with help, some type of stimulant or whatever. And he had to go in and out of Children's Hospital to get disimpacted because he just couldn't move it. So there's basically a big muscle that runs the entire length of the colon that when you eat or that reflex gets stimulated, it shoves all the stool around, and that's what triggers the bowel movements. Well, it's just like any muscle. If you have a weak nerve supplying that muscle becomes weak. A muscle can't be stronger than the nerve fiber supplying it. So what I find is that essentially it's the nerve supply to those muscles, or the muscles that move the colon, that are weak. And when we remove that nerve pressure, that muscle just starts firing and it does what it's supposed to do. Now there are other types of constipation that have more to do with water absorption issues or what have you, but that's not his type. And it responds really well. It's one of the most consistent visceral type problems I see that we help. So and it's extremely common. Lots of people are constipated, and we obviously see this a lot in babies too, because we do a lot of pediatrics here. So I checked him out. He's already doing great. We've pretty much resolved all his problems. He just has an occasional ache and pain here. We're just kind of continuing on, but I wanted him to tell a story. So I'm going to go ahead and adjust him and get him out of here. All right. Got the first one up here. If you want to go to the front. Just relax. Perfect. Nice and easy. All right, let's get you over here. And the Gonstead work, the reason why we can be so effective is that, our job is to find that nerve that's being pinched or that damage that's causing that nerve interference. And in Gonstead, just like you saw, I'll be checking them. I don't do that just once, I do that every time I see a patient. So before I ever lay a hand on them to adjust, I'm very, very sure that there's a problem there that needs to be corrected. And I have a detailed x-ray to know exactly how to correct it. That's why Gonstead was so effective and famous for what he did. Got one more here. This is actually the one that affects his constipation here. Nice and easy, good. Perfect, good. And it's that simple. And so, just know that when you have a problem, you think maybe, oh, that's not a chiropractic issue, it may be worth your time to go talk to a chiropractor and get their opinion about it, because you'll be surprised what doesn't come from nerve pressure. So while we're not treating, these diseases or conditions, the root cause of why people have them may in fact be nerve pressure. So I hope that was enlightening, guys. He's a great patient, and it's a great case, so I hope you learned something. Well, all right, until next time, bye-bye.